Have you had enough of chronic lower back pain or neck pain being a part of your daily life? Are you ready to take care of the problem once and for all? Hi, I'm Dr. Mark Gould. I'm a chiropractic physician and internal healthcare specialist with Back to Health Wellness Center, and I'd like to welcome you to my website for spinal decompression back pain relief. On this website, I've created a number of areas for you to learn more about me and what makes my treatment approach so unique for people like yourself, people who are suffering needlessly with various spinal conditions like lower back pain, neck pain, pinched nerves, disc herniations, disc degeneration, sciatica, and spinal stenosis. To the left of this video window is a place for you to request 2 free visits at Back to Health Wellness Center. I make this offer because I want to give you the opportunity to see if you qualify for care and also give you the opportunity to check us out without any financial commitment. There's also an icon for the virtual decompression area for you to view, and another short video there explaining decompression and to learn more about a number of spinal conditions, including some unique interactive software you'll find both interesting and instructive. The chances are you're watching this video right now because either you or a loved one is suffering with persistent neck problems or lower back problems. Now, this may be your first inquiry about what to do about the pain, or you might be like many patients I've seen over the years who've concluded that they have little choice but to live this way, submitting to the ongoing use of medications or injections. Some of them reached the point where they believe that surgery was their only option. And even if there has been surgery, there are continued post-operative problems that the general non-surgical treatments I offer in my office have helped hundreds of patients. In any case, I wanted to let you know that there is hope and there is a solution to your problems. If you're suffering from low back pain, you're certainly not alone. Look at these statistics. Over 80 to 90% of adults will suffer with low back pain at some time in their life. Low back pain is a leading cause of disability for people under the age of 45 years of age. Lower back pain is the second leading cause of visits to doctor's offices. Lower back pain is the third leading reason for hospital admissions. Annual costs of back pain range as high as $75 billion in the United States. And studies indicate that 15 to 20% of the population have lower back pain in any given year, approximately 32 million cases. I know it can be very frustrating living with chronic back pain because it was my own back problems that led me to this profession. And the stories I've heard over the years and the pain that I've seen in the patients' faces have made me keenly aware of their frustration. They've endured both their symptoms as well as countless useless treatments that have brought them little relief. However, my experience with them has made me very passionate about becoming an expert in understanding these conditions and delivering treatments that do bring relief. You've probably never heard of some of the treatments I use in my practice, so you've definitely never heard about them at your doctor's office since they have nothing to do with prescription drugs or surgery. Our treatments are based on the most clinical and scientific research. One of the biggest accepted myths about back pain is that it goes away all by itself without treatment. Most medical doctors believe the claim that 90% of all episodes of low back pain will resolve within 1 month. However, a May 1998 study in the British Medical Journal that followed the progress of a widespread sample of back pain patient conditions for 12 months after their initial medical consultation found that only 1 out of 4 patients saw their pain resolve. Sadly, 3 out of 4 continued to suffer. So how am I different than all the other doctors you've seen, and what treatments do I have that are different than anything else you've tried for your condition? Well, briefly, I treat patients metabolically and neurologically, and I'm part of a select group of doctors across the country that are sharing diagnostic and healing methods that are helping thousands of pain sufferers just like yourself. One of my mentors, Dr. Michael Johnson, is the author of this best-selling book, What to Do When the Medications Don't Work, a non-drug treatment for dizziness, migraine headaches, fibromyalgia, and other chronic conditions. This book and Dr. Johnson's ongoing work with doctors like me across the U.S. has literally changed the lives of thousands of pain sufferers, and I'm confident it can help change yours. I've been studying back pain with some of the top physicians around the country and have traveled the nation to learn what's working for their patients so I can bring these breakthrough treatments and advanced technologies to you. One of the things I've learned over the years is that each patient's case is different, and there's no one-size-fits-all treatment. Each case needs to be evaluated fully to determine what steps we need to take to get you feeling great again. So at this point, I'd like you to join me and take a quick tour of the office to help you understand what makes my clinic approach different from those other doctors who may have treated you, and to show you some of the treatment methods that I found to be most effective with conditions like yours. So come on with me. Hi, this is our spinal decompression treatment area, and I wanted to show you what treatment looked like and to tell you a little bit about the equipment. During the entire treatment process, you're going to be very comfortable, and many of my patients, just like this one, fall asleep. Actually, this is, well, it's kind of a friend, patient, so I'm just kind of kidding around a little bit with Kate, but in actuality, you are very comfortable most of the time. I also wanted you to see how this table, how it works, but also I wanted to tell you a little bit about it, because it's actually designed by Dr. Jake Kennedy, who's used or literally taken apart pretty much every table ever manufactured. Dr. Kennedy has also had decades of working with patients clinically while designing these tables, and has educated hundreds of doctors and therapists like myself in the correct use. I have found it to be pretty much the most clinically effective and comfortable table out there. Now, this table is the only one on the market today that's based on clinical science and biomechanical research, and not some marketing hype your doctor has been told. Some people come to me and they have been telling me that they need to be treated on table XYZ or some other type of table due to the manufacturer's marketing hype or the doctor's own conviction that since they've overpaid by tens of thousands of dollars for a table with a video unit on it and many other impressive bells and whistles, that's where the magic is at. Well, the secret behind the impressive bells and whistles is there's really a basic principle, a basic function that's happening that's the same with all tables: to establish a decompressive force in the spine and to create an imbibing or gentle motion of the spine and disc. It's kind of like when Dorothy from The Wizard of Oz discovers that the Great Oz is nothing more than a man behind the curtain pulling bells and whistles to create a greater appearance. That's what it's like with most of the tables. Most of the aspect of the table of your treatment is not the table. It's me. It's the knowledge and training of the doctor that makes the difference and not the table. So here at my clinic, I can assure you that you're getting treated on the very best equipment available and that you're seeing a doctor that's properly trained in the diagnosis and treatment of your condition. So let's move on to some rehab equipment that I wanted to show you. This piece of equipment is called the ATM2, which stands for Active Treatment Movement Device. It's been a fantastic addition to the clinic and has been helping resolve many different types of problems with the neck or lower back, in both cases with and without radicular pain. Now, I know it looks intimidating or something you might want to put your in-laws in, but it's really actually very comfortable, and in some patients' cases with lower back pain or neck pain, it's all they really need. And I've seen patients who've not responded to anything stay pain-free after several visits with the ATM2. And the nice thing about it is that the person actually sees not only just pain relief, but they actually, along with it, they see increased range of motion, which is essentially something you're not used to as a clinician seeing with other therapies, but this one is actually very unique. The therapy, basically, you're taking a person, you're putting them in a safe position with the stabilizer belts, creating a functional weight-bearing position. And then using these stabilizer belts, you're creating a temporary external force that repositions and compresses the body area, which the goal is to take a motion or movement that's currently painful for the person and create the same motion into a pain-free one. So I'm going to do a little demonstration with you here and show you what it looks like. So what I'll have you do, Kate, is now that we're in this position and we've discovered that going forward, which used to be painful, now with the stabilizer belts on, we can actually have you go forward and it's pain-free. I want to show just how this actually looks. So what I have you do is just arms up here like this. And what you do is bend forward, push against the belt, giving about 50% effort. Are you experiencing any pain? Okay, good. Hold that for about 3 seconds with 50% effort. Then I want you to come back, go back up into the neutral position. Wait about 3 seconds. Go ahead and do this again. And again, the goal is to create a resistive motion, and this is actually helping to basically, over the course of several visits, continue to restore normal firing patterns in patterns that were previously considered dysfunctional or pathologic. And this is actually something that's going to set and hold in the nervous system, and it's extremely important to restoring long-term pain-free function in the spine. Let's go ahead and move on to the laser unit. Hi, here we are with the LightCure Deep Tissue Laser Therapy Unit. It's an amazing new technology that very few clinics in Illinois offer that reduces inflammation, in many cases eliminates pain, and promotes faster healing on the first visit. It's referred to as a Class 4 unit, and it's the latest therapeutic laser to be fully approved by the FDA. It's 1,500 times more powerful than its Class 3 cold laser cousins, but those are still being used by most healthcare providers today. Now, its effectiveness lies in its ability to penetrate much deeper below the skin, to a depth of 3 times that of its Class 3 cousins. And it repairs tissue faster without no known side effects or risk. It's already being used by a number of professional sports teams to reduce pain and promote faster healing. But my center is the first and still part of a very small number of healthcare providers in Illinois to treat patients with this breakthrough technology. Now, laser therapy is a natural addition to decompression therapy because it helps to reduce the inflammatory process, relieve pain, and promote healing in avascular structures such as the spinal disc. Now, we use it in many cases of lower back or neck pain, joint pain, arthritis, injuries, repetitive motion, things like carpal tunnel syndrome, plantar fasciitis, or tennis elbow. And the results our patients are getting are sometimes nothing short of amazing. Treatment times are short, with relief happening in as little as a few days to just a few weeks, and no known side effects, so it's very safe. As we age or recover from trauma or surgery or simply need relief from everyday aches and pains, this advanced technology offers my patients a drug-free, surgery-free, pain-free, and effective treatment alternative. Now that you've seen, I've equipped our clinic with some of the cutting-edge approaches to treating your back or neck condition. What I'd like you to know is that I understand that every case is different, and that's why our treatment philosophy is always to treat the person, not the diagnosis. This is why, as a clinician, I look at each case from a functional neurology standpoint and must also consider the metabolic factors included with your whole body if we're going to have success restoring your good health. Your therapy plan will be tailored to fit you and not just your diagnosis, because focusing on just one area alone can lead to the wrong treatment approach. Now, I know you've probably been through a lot and at some point may have just wanted to give up, but I want to ask yourself the following questions. How has your condition affected your relationships, finances, family, or other activities? What does it cost you in time, money, comfort, happiness, and sleep? Where do you see yourself in the next few years if this problem isn't taken care of soon? And what would it be worth if we could improve or eliminate your condition? If you're tired of dealing with this problem and are worried about it getting worse, order my free report and learn about how we can help. Just fill out the form on the side of the screen, and to schedule your 2 free visits with us, include your phone number so our staff can contact you, or just call us at 847-550-1818 and we'll get you set up for your appointment.